Hello, my name is Dr. Steven. I'm here to talk about Lassa Fever. Lassa Fever is an acute febrile disease caused by the Lassa virus. Lassa Fever occurs in the dry season much more than in the rainy season. The reservoir host of Lassa Fever is a species of rat known as the multimammate rat or Mastomys latalensis. Humans are usually infected with Lassa virus from exposure to the excreta of the multimammate rat by eating food contaminated by the rat's excreta. Also, people become infected by eating infected multimammate rats. Person-to-person transmission also occurs through direct contact with the blood, urine, feces, or other bodily secretions of a person with Lassa fever. Signs and symptoms of Lassa fever typically occur within 1 to 3 weeks after the patient comes into contact with the virus. About 80% of people infected with Lassa fever virus have mild symptoms. Mild symptoms include slight fever, generalized malaise, and weakness, with headache. In 20% of infected persons, the disease may progress to more serious symptoms including bleeding gums, eyes, nose, and bleeding into skin with vomiting. They may also experience respiratory distress, facial swelling, pain in the abdomen, chest, and back, and shock. Neurological problems such as hearing loss, tremors can also occur. The most common complication of Lassa fever is deafness. The death rates for pregnant women in the third trimester is particularly high. Pregnant women who are infected with Lassa fever virus are at high risk of spontaneous abortion, and 95% of mortality in the unborn children of infected pregnant mothers. The goal here is to prevent the primary transmission of the Lassa virus from the host, that's the multimammate rat, to humans. The following preventive measures should be taken. 1. Put your food away in rat-proof containers. 2. Discard any suspected food eaten by rats. 3. Do not catch rats for consumption purpose, and do not eat rats so as not to consume infected rats. 4. Keep your environment clean and maintain good hygiene. 5. Help reduce the population of rats in your home by using rat traps. Now, for the health workers, person-to-person transmission can be prevented by maintaining universal precautions such as 1. Using appropriate personal clothing such as hand gloves, face masks, eye goggles, and overalls, which must be worn when attending to cases. 2. Hands must be washed after each contact with patient or contaminated materials. The hands must first be rinsed in disinfectant and then washed with soap and water. 3. Each patient must have an individual thermometer labeled with the patient's name and kept in a receptacle containing disinfectant. The stethoscope and the sleeve of the sphygmomanometer must be decontaminated between each use. The use of a plastic waterproof sheet as bed covering is essential to avoid the contamination of mattresses. The plastic sheet must be thoroughly disinfected after use. Infected patients must be isolated from contact with unprotected persons until the disease has run its course. Prevention, they say, is always better than cure. Do help in any way you can to help prevent the spread of Lassa fever. Let's make Nigeria a healthy nation. Pass this message across to your friends and loved ones. Thank you.
Please report any suspected case of Lassa fever to the health center closest to you. This message is from the Nigerian Medical Association, Edo State Chapter.